and then just kind of look and
No
see.
holes. Is there
Make
any
sure
holes?
that there's no holes.
Right?
So you can throw it on here. And now you're gonna drape this.
These are gowns, extra ones. I can throw those right there.
They're gonna go on your prep table. Okay, so, yep. So you're gonna do that.
Well, this all I need
You're gonna be doing this.
I always muck this up.
Look at the time to make sure you see, make sure half an hour's enough. Okay,
Good.
now you're gonna take everything from there.
Come over here.
Yes, nice, nice move there. Okay.
Can somebody put those up on the thing?
What?
Hmm?
What thing's up on the thing?
Huh? Those handles.
No, that's when the surgery starts. So you move your gowns over, the gloves over. Yep,
I can just throw them there,
Yeah.
right?
yeah, that's all sterile. And now you can go get your stuff over there. And what are you gonna say when you see, what are you looking
I'm
for?
gonna check for the tag.
Right,
It's changed, and there's no damage to the casing whatsoever.
okay.
Fair enough?
Okay, you gotta grab it from the other end. Yeah. There's a little handle on each side. Yeah. And I like the way that you stayed back, that's good. Where does it go?
It could go right there, and it could go right here.
That's right, just move that out of the way.
It's fine right there.
Yep, there you go. And then,
I could take this off.
yeah, you can, and just take your square base out, this, out from underneath.
Right?
Yep, and take that
Whole
whole
thing.
thing right out and set it right there.
Oh, that's what you're saying, right?
Yeah,
Okay.
there you go.
You want us to set this up?
Yep.
Remember, it's Sunday.
What do you have against Sundays?
Sundays are like a day of rest, aren't they?
No.
You don't like Sundays? I'm usually like couch potato.
That was me. I usually work.
Been a while since did this. Holy smokes. No, that doesn't go there.
I feel special.
What a strange school. What's that usually?
Oh, it's the
for?
best. Makes you sit straight.
Oh,
It's for the circulating nerves.
that's interesting.
If I'm sitting in plastics and I'm knee assist, I always use this chair. I love it. Guys
Never
don't
seen
love it
one.
so much.
No.
I think that's the chair the dentist use.
Hmm?
I think that's the chair dentist use.
It's fantastic.
Why
There's
am I having a brain freeze?
Because we're filming you.
Because what? Sunday?
Because we're filming you.
Oh, and probably because it's Sunday. No,
That doesn't even go like that.
no. Okay, so that one that you just had, pick it up. No, the other one. That one. Take that blue out of there.
The yellow
Put it
goes
on the
in.
other end.
That's right.
Put the yellow in there.
That's right.
That screws into that one.
Yeah, that one.
Yeah. So there's 3 that are exactly alike, just 2 of them are exactly the same and one's just a little bigger. So they work the exact same, right?
Oh, you know what?
Elastic.
Elastics. Okay, that one goes with that one, that one goes with that one, that one goes with that one. Correct.
Yep. Yep.
And the red one went with this
Yep.
one. Right on top.
Mhm.
And this one is the blue.
And that's the one you have to poke through
This
with
the
the dull
one.
one? Yeah. It's the easiest way to get it in.
Okay,
Turn it the other way.
this was a lot easier
Turn it the other way.
before.
There you go.
Like weeks ago, man.
Okay.
And then this one went.
You've already got it on your saw and you gotta take it off.
Oh yeah, there it is.
Now I can go back on. Okay.
Oh my god. Am I new?
The other end. Turn it around. Turn it around. There you go. It's always fun to watch the first one and then you guys will be like, "Rah, I got this." Let him struggle and then you learn from him.
That was encouraging. Is that the right one?
Yep, that's the right one. Mhm. You'll see the Hassan is just a little bit smaller than the 10. So it's the kind of what the elastic that's in the middle. No. That one looks just like the 5, right?
Yeah.
So it's,
So what am I missing?
that goes
That
on
one,
there.
yeah. And then where did this one go again?
That one goes on the different one,
Where's that one?
right? It's the only one that's different.
That's right. With the teeth. Remember the teeth with the Hassan.
Yep.
Oh, I forgot one.
No, you didn't
It's
forget
this
it.
one you forgot.
Can't believe it took me that long to figure this out.
Yeah, it's been a bit.
There's no excuse. Okay. And this would go on.
Eventually.
Eventually.
It would go on, actually the other one here. This one is the one that the scope goes in.
Right.
that's the
Oh, yeah,
one
that's
that
the one
could
that
use
goes for
our,
the 10, 5
yeah,
to 10.
5 to a 10.
Okay.
Okay, you still have instruments?
Do we have towels? Extra towels?
Oh, I did mean to give you some towels, so I did bring them in. So I will be giving you towels as well.
So this I could put where?
Usually where I put it is I put it like right here, like that,
Okay.
right?
And that too can go right
Yeah,
there?
and that one can go actually
Oh,
right in
okay.
there, right?
And
That's
then
where I
you
put
leave
it.
these here?
I put a towel out
Yes.
because they're sharp.
Right.
So even if the towel is even just half, right?
Sorry.
Because you're really only gonna, and I put it in the order that I'm gonna hand it to the surgeon, so
Okay.
it goes like this.
Right.
So the Hassan's first,
Right.
then the 10, then the reducer, then the
Right.
2 5s.
Okay.
This comes here, this can go there, and your instruments go right there. And you bring the whole tray over.
What whole tray? Where? Oh, yeah. But you would make a roll though, right?
Well, what I do is I roll it right in the instrument pad. Remember? Like this. So I pick it up, bring it over here.
Yeah.
It goes here,
Yeah.
right?
But you do the roll.
Yeah, I do it right in here.
Don't remember you seeing you do that.
No?
No.
Do you guys? Yeah.
Don't shake your head, Jess. Teachers.
And all I do is that this is already folded like this.
Right.
So the easiest way for it to fit in here is to just keep it rolled like that. Just roll it like this.
I have never seen this done.
And then like this.
I must have been away that class.
And,
Well, that's awesome.
okay? And then you're gonna put your,
Right.
these here on the side.
These going.
Yep, that goes there. And then my retractors, I just leave them so that you can count them. There's, and
Right.
remember
Yep.
that there's these here.
And
Wow.
make color.
And the cord would go in there. We would put this off because we're not gonna count it,
Right.
okay?
Right.
So that's basically your setup, okay? And then this here, ooh,
These. Punch them right in the head.
oh man, I thought he was talking to me.
No way. And then this can just be, you don't want to leave it in there.
No, you're gonna drape it,
Right.
remember? Do you remember how to drape it, guys?
We've seen it once, no.
Okay.
To be quite honest with you.
So, the easiest way, you're gonna have your gloves on and gown, is put your hand into the hole,
Okay.
right? Bring your hand right to the hole,
Yep.
and then this just goes this, and then you're gonna bring it back down over your hand, okay? There's a little hole here,
Yep.
okay?
So it goes through the hole.
It goes through the hole, so try it.
Are we gonna be doing this part on there too?
So it just goes like right here?
Yep. Feed that right through that little hole.
This big thing is supposed to go through that little hole.
Yep. We put a baby out of our hoo-hoo, and it's like this big, and the baby's this big.
I don't want.
I think we could do that.
I don't want to experience that. I dealt with it last week. Okay.
Okay,
like
and
that?
now just bring it back over your hand.
Can I touch this?
Yeah. You're gonna bring that back
And I
over.
still hold
And
it.
what you're gonna do is you're gonna bring it like this. Let go first.
Sorry.
Sorry.
No.
You're gonna bring it, just keep this together, like
Okay.
this.
Okay.
The reason is because way that we're gonna hand it to the circulating nurse, because I'm sterile, right?
Right.
Is I'm gonna hand it like that. Cause then she'll hook it on from here and she's gonna pull it up and over the cord.
Okay.
Okay.
So you just want to get it to that point, and then.
And then
give
this
it
is
to
done, this is
Present
ready,
it to the
just
circulating
like that,
nurse?
okay?
Okay.
Right? So basically, this is what I want you to do, is I want you to do this setup. I'm gonna randomly give you instruments, and I'm gonna either give you a Clevenger or a 3-prong grasper, one or the other that you have to put together,
Okay.
okay? I wanna make sure that when you do this, that these are closed. So don't forget to do that. Don't forget to close these, okay? Because when they insufflate the belly, if these are open, it's gonna just let that insulation out. So we wanna close the tap, okay? So I wanna see that. I wanna see, even you just demonstrate that you're gonna close these. I don't care that we're gonna close all of them, because then we just have to reopen them. But these have to be closed as well, okay? So even if you say, close a couple and say, I would close all these, okay, then that's fine. So this is basically the setup, okay? So your instruments in a little towel here, your tissues here. That's where your blade's gonna go. Instruments. I'm gonna give you a Clepinger, and you're gonna gown me. Because
Way you go.
because we need experience with that,
Yeah,
right?
I don't think we've done anything since like the first or second. week.
Exactly.
That was horrible setup. Don't ever do this, people.
Good job.
Well, now you guys got a picture of what is, and that's, and I'm looking for efficiency, right? So what he did was he looked to make sure that there was no holes in this drape, right? Before he brought this over. This can go off now, right?
Okay, now? Okay.
Yep. And then he draped this, because once this is draped, then you can get your gowns up there. You can take this whole pack and put it here, right? So that kind of clears off your whole table. So now you've got a completely empty table. And that's what you want, right? So then you did it right. You brought his small basin set up, and he kind of pulled those out. That's perfect, right? That's what I want. So because once this is out, then you can put your cords in there. You can put some stuff in there. You can even bring this back over here eventually and throw it in there, right? It's kind of collection. You can throw your 4x8s in there, right? Because this stuff is going to be counted. So what's only going to be left on here is your gowns and your drape. Okay? That's it. Right? Now, if you want, if this is completely right, fine to put your dishes out so that they can pour. We don't use providine unless we're going into an orifice. Basically we just use the pink, so I don't even put this out anymore. So I leave it on my table. But if you put it out, I wouldn't care. I'd be fine with that. Because eventually it would just go. Okay?
Yep,
Once
fair
these would fill, you would bring it back, you know. So you can leave them on the edge of your table, they can fill them there, or bring them in over here, that's fine.
That's okay to put that there?
Yeah.
And work,
They can
and
pour,
you can work
she
out of
can
that
pour
tray?
it from there.
Because it's still sterile.
Mhm.
Okay.
This whole table is
Okay.
sterile, okay?
Right, okay, I get
So
it.
with the Clepinger stuff and everything, what do you mean by you're gonna hand us?
So I'm going to randomly pick one or the other for you to put together. And you'll get marked for that.
So where would you set that up now that this is all here?
So
Where
this-
would you put it? On this table? Would you work off of this?
What I would probably do
Or your
is,
mail?
I'll open this up, and it'll be open after the first couple people. I do have a few, so, and I would open it up to you, like this. And what I want you to do is take it, and you're not gonna put it on your table till I make sure that there's no holes in this. If you randomly put it on your
Fair
table,
enough.
then you'd have to tear this whole thing down if it had a hole in it, okay? So that's something I want you to make sure you look for an indicator, and I want you to make sure that you allow that person to make sure that there's no hole in this. So even, either way, it's gonna be like this. I'm gonna be wrapping it back up, right? And I'm gonna pretend that I open it, and you're gonna take it, and you're gonna hold it up. Don't put it on your table, okay? Right?
Can I put that together?
Yeah. But,
Yeah, I need help. with
I've
this
got
too.
Clepingers here. Okay, so who would like to do this now? Because we can string this back and do it again. And I think if everybody gets a chance to do it, you're gonna feel a lot more comfortable with
I'll
it.
do it.
Yep, yep.
That was good. Thank you.
This is like a bipolar laparoscopic. Yeah.
So what about this?
They're
So Rachel,
exactly the
just
same
take
as
that.
carpets, but I always
Would
hand
that
down
be
my
considered
phone
sterile,
tag
but
that
before you actually
they
set
fit
it here,
here.
that's when you'd lift it up,
You
check,
see
and
the
then
ends
put
are
it on.
different. I always
Just to make sure
load
that
this
doesn't
one
have holes
because
in
I
it.
find
Oh,
that
yeah,
it
the wrapping
gets
that
stuck
doesn't-
in a hole.
Okay, and then this
So
goes
this
back
one
over
really
here.
doesn't work very well. This one works way better, so I always do this one. I don't even know why this one comes, but it does. Okay?
Do the 3-prong grasper.
My notes?
I was trying to set that up like this.
It's folded differently.
Yeah, it is. Crap. Here, you can still do it.
It
So,
would go this way though, right?
oh, true. Yeah.
Well,
Do it this way, just in case. So what you would do is you would,
Grab towards you.
yeah, you would grab this one towards you, right? And push the other one back. As long as you have
That's what I need.
the technique.
Okay, so that's what I would do, and then
Yeah.
I'll flip it.
The other part.
And then you wouldn't want like the bottom of that touching that, okay? So just be careful of that. but it wasn't, they'll
That was
be
the tricky
folded
one,
properly.
was
I could just
turning
grab
it
it,
and
or no, I
lining
move it
them
with my
up.
feet, right?
No, now you're sterile, you
But
can
if-
grab this all you want, okay? Yeah, now you're just gonna get rid of everything off your table, everything.
And my stomach's
Yep.
really-
Clear your table off so that you have
I
a
hear ya.
space.
Anybody watching the Oscars? You going home and watch it? Yeah, 8 o'clock.
These go on this.
You can actually just set it right there. Yep.
And then next is the instrument.
Yep. So you're gonna, I'm gonna leave the indicators on it for each person. So I want to hear that there's an indicator that it's changed.
Yeah.
And when you pick it up, make sure you're kind of like this, right? Yeah.
Hey, look.
Right now.
There's me in another 20 years.
Okay, so, here, you can gown me. Okay,
And this goes back,
remember how to do it?
right?
No,
Have
that
the
stays on the
gown?
table.
Yes.
Oh, okay. Yep.
You put your gown on?
No, I'm the surgeon.
No, I totally forgot.
Okay,
I honestly
so
forgot.
when you're gowning yourself,
Yeah,
This
you're
goes
putting
in
it in here,
Yep.
right?
Yeah, yeah.
So basically, you wanna turn it so that it's facing me, like
Right.
that, right?
Right.
So the way that it faces you is, this
Right.
is gonna be to your body, so you want this to come to my body, right?
Give it right to you.
Yeah.
I don't know how many gloves on, but okay.
Yeah, that's okay.
So I can take this.
Yeah, pick it up. Right, and then you're going to just, what I find the easiest is when I'm doing somebody is just take it by the neck,
Okay.
all the way around.
So let's do that. Can I do that again?
Yeah,
So,
because you're gonna be sterile,
right,
right? So you can pick it up anywhere.
right here?
Yeah.
So
And
red
then-
and gray
There's
on the
neck
small
right there,
ones.
right?
Right.
If you do that, then it's gonna fall
So
out.
where my
Like
hand?
this, I'll show you, like this.
Okay, yeah,
Right?
I get it.
See what I mean?
Yeah. So I can grab that.
Yeah. Yeah, and then I'm just gonna do this,
I thought,
and then you're gonna
wait a minute.
glove me.
Oh, you want me to do that one?
This one
Okay.
goes in there, right?
I think
So
so.
I can, I don't have
Is
gloves
that-
on.
Yeah, but you normally would.
Yeah.
So I can grab them?
Yeah,
I
you
think
can
it's on,
just
yeah,
grab
the
them,
top
yeah.
of that one maybe.
That's wide enough.
Yep.
I don't know.
Is it the white one that goes on that one?
Yeah, maybe.
Is
And
that
then-
what you need?
Yeah.
Good.
Nothing
no.
goes on
Okay,
the
so you
block,
want the
right?
thumb
Thumb,
on me,
yeah,
right?
right there. Thumb is the-
Okay.
Other than the
I'm
little.
gonna-
But I thought the gray one went on this.
Yeah, that's what I thought too.
Okay,
There, perfect. Turn around.
well, you would be able to do that, right? Because you're
Right.
sterile,
Right.
right?
I think it's that one.
Ah, right. Remember that.
So you think that's right?
I remember
Yeah.
all that.
So then this one is
You
blue.
want to do that to the test too?
Yep.
So we're missing one? I'm
Yeah.
confused.
Just give me,
There's another
just give me
down
a 3 out of 10, and we'll just call it a day.
You have to pass this to pass the course.
There'll be $50 somewhere too.
Yeah, I need another, gloves.
No, it takes
I
us
did
$50.
bring my gloves. $50, oh, way more than that. What? Okay, so when you're gowning yourself, right, you're picking it up this way, so you want that facing me.
Wait,
Right.
it's this
So
one.
you,
though,
you're
the
sterile,
red
so
one.
you
Oh,
can
and
pick
maybe
it up,
that
because you
little
wouldn't
black
know.
one.
Well, when you're doing
And then
this,
this
you're
is
gonna
yellow
have to
inside,
glove,
right?
right?
Yeah.
So you're gonna just
Oh,
let
and
it
this is
fall.
great, right?
I find the easiest way
Nice,
when
this is
I'm gowning somebody is to actually grab it by the neck and just kind of trace my fingers around the neck.
So
and
when
kind
it's
of
on the
open up.
table,
Yeah,
we can't grab it by
Yeah,
the
you
neck.
it's sterile, right? Yeah, and then it doesn't have to go right up onto my shoulder because we don't want you touching me, right? So like this,
You wanna use your shoulder
sure.
since you're not.
Well, what I find the easiest way when I'm, is I pull the gloves right out, and I take my thumbs, and I put them like fairly length down, right? So that I get a nice, and so really they're only going that far into the gloves, right? Okay, so,
The thumbs
and then
towards
you want
you.
the thumb towards me. Backwards. or did I put it on the red glove?
It's longer. It's the weird one. This is long.
Too much fresh air.
Okay, so,
See, there's
where's the thumb?
right here.
Okay. Okay. Okay? Not that bad. Couple of crackers. We'll do that,
And this
on
points
Wednesday
up.
as well. Because
This
that's
points
one
up,
thing
right?
that I really
That's
wanna
close
get,
up.
you guys are getting fine with, loving yourself.
Where does this one go?
So now, let's get you used to getting the person.
Fair enough. Is there any way next Wednesday we can get some cloth gowns?
Yeah, I brought them a bunch in today, but I'm actually gonna bring them for next week.
Yeah.
Yeah.
Practice using those.
Mhm.
Do you
And
mind?
then
Actually,
she
they're
had
easier.
them set up on
They're
a
always
cloth.
easier. I don't know why, but they are. I think they are.
Okay, Debbie, can I just get you to watch
Just
me
like
do this?
that.
Yeah, just fold it in half, just so they don't
Like
poke
this?
through other way.
I don't remember the order, but.
Oh, it's fine.
She said the order and way you'd hand them, so this one, this one, this one, this one.
Oh, so opposite. Okay.
Forgot one more.
Okay, so,
And then do we put these in when
basically,
we're
with this maneuver, with this, I'll show you.
Cause she wants to know that you're knowing which ones to
Okay.
put.
Okay, so pull this down like this. Give
Oh, look, it
yourself
goes
a-
down.
Throw this in here. See how there's a little screw right there? It screws into this part of the handle, okay? And then this screws onto that part. So you have to screw this
And then your
handle
second
onto the
instrument
handle
basket.
first.
Oh,
So
yeah.
just do this. Okay, so that, and you can actually feel it empty. And then this screws onto here, okay? So it's actually, you're screwing one way, and then you're screwing the other way, okay?
So that was that.
Okay, now I'm.
So yeah, so keep it like that.
This?
Yeah, and then roll one side
Oh,
a
yeah.
little bit.
Where does this go?
Just throw it in the bucket. Basically, what they use for that back for is, when the patient's down, laying down their sleep, they take that with the towel clip, they clip it onto the drapes, and then they can put these in it to hold them. So if they're ones that they're going back and forth with.
Would we lose marks if we left those thingies in here? Those, remember we put them back over there? Oh, this thing.
What?
Oh, they're really
Yeah, no, we're gonna put, once you roll this and put it in there, I want it off, because we don't count it. With a lap chole, or with laparoscopic, what we do is we count everything in. So everything, all your instruments, we count, these are called trocars, these are called sheaths, right? This is, a reducer, so we count all of this, we count these rubber seals, we count all that stuff, but when we're going out, if the lap chole, we take the laparoscopic and the belly button, we don't open the patient, then we don't have to count all the stuff out. But if they get a bleed and they have to open the patient, we wanna have everything counted.
It's so
Where's the other towel for
Where are you
this?
counting?
across the threads.
Hmm?
Because they're so small.
Where are you counting for the test here? Do you know?
She said no, right?
Yeah.
Thanks. There, that's it, right?
Yeah.
This is the right order.
Yep, and yep, that's the right order, just this one goes there, right? And the only thing I don't do is I don't have the sharps pointing towards me. Go. I have them facing out. But perfect, you want the doll one, because that's the one, right?
Song.
The Hassan, that's right. And you put that there, yeah, no, this is what I want. And then you're going to drape,
That thing.
where,
Scope.
Yeah.
And you're gonna close these doohickeys.
got it?
Am I doing this right?
Yep.
I don't remember what any of these are called, I don't think, besides that one.
Mother-in-law,
Double action
fundus,
graft.
strong,
Maryland, isn't it?
I don't know.
Wait, what's
Maryland,
the-
start of the M.
Maryland, yeah.
What's
So
the in-law one?
this,
Yeah.
That's
no.
a- That's a
And then it
fundus.
Sits here?
Fundus
Sure
grasper.
that those, like,
Or an
all
access
the-
grasper, one or the other.
that?
That's the mother-in-law.
So
With
that
the
it's
big
like
teeth.
that, so that she can hook
Strong
that
is the one with
to
the
the
hole.
machine, 'cause
Double
the
action.
circulator just comes and hooks that.
This is a double action.
And it sits
This.
here? Yep. So I'm done.
You said that
Yep,
one's
you're done.
Yeah,
Strong.
Yay.
yeah.
Mother-in-law,
All right.
strong. Where's the fundus
Okay, we'll
one?
put it
Right
back
there.
together
Right
for
there.
somebody else.
Double action.
And that one's a double too?
Yeah. Is this, what do they call
This
it?
one's a hook, correct?
Mites, not mites, Mets, thank you.
This is a hook?
No,
Hook
but,
scissors
yeah, hook
is-
scissors. No, it's,
That's the hook scissors
Yeah,
right
that's
there.
what I said.
and then what was,
Confused.
that was the staple.
What do you want me to do? Put it together?
Yeah.
I thought you said you wanted to try it.
Okay, then someone record me. It's recording now.
Like I say, when
Okay,
I'm,
so
This.
when I'm an assistant,
here,
No.
and I'm sitting, that's what I
I think you put that one in, don't you?
in,
No. Well, eventually, yeah.
here.
Let me show you first.
Yeah.
The chair?
I was
Yeah.
gonna say, it's
in
like a
here.
side.
Guys don't like it. Well, we have one guy that likes it.
Oh, and then,
Now.
No,
And
he's
then-
unique in this. He's married and everything.
and then,
He's got his reasons.
He's not-
He's out in left field.
He had,
No bunch of those.
Can you
he
twist
built
that?
a boat and he says
Oh, right
to,
on.
he says to one of the guys, we have a nice looking guy that works here. And he says to him, so, you wanna see my boat? Like I built my boat?
Did you do that?
He goes, yeah, I wanna see your
That's
boat. And anyway, it's him like beside his boat in a Speedo. Holding his oar. In a Speedo. So the girls are like, okay, I wanna see these pictures, right? None of them he had a Speedo in, not one did he show the girls.
I'll show you.
Not one. Yeah,
it's the same,
so
right?
fun.
Kinda.
And Mike is going, oh,
Where's this
whoa.
You already missed right there.
Whoa.
Yeah, it goes on the first.
Okay, so
The other way.
I don't remember this at all. Are you sure? That might make sense.
Oh, yeah, that way, yeah.
Now, what does this one do?
They just comes with two. They're just different.
Oh,
one
one's
has a hole.
called-
She always, she loads this one because she finds that that hole.
Yeah, the
Sticks.
whole one sticks to the tissue. And you're gonna wanna back up, right?
No,
Because this is not sterile, this is not
no,
sterile.
twist it.
You would've, yeah, so just when you're doing it, just make sure that you kinda step back. Like I always say to people that if you're draping,
Put it
a
on
table
backwards.
that's not sterile and you're comfortable, then
So
you're not doing
push-
it right.
make
You
sure
almost
this
feel
is lined up
uncomfortable.
with
You
that.
just feel almost awkward when
And
you're
you
doing
push
it.
that in.
Because, and that kinda,
Pull that.
if you're standing there and you're comfortable, then you're going,
Oh.
okay, there's something wrong here. Oops, standing too close, right? That's what I say. Yep. Okay.
What did you do to it? I think this is too far. Yeah, there. Then it clips.
Oh, what about this?
And then you turn this around,
Oh,
press
yeah.
the button. Or you push this in together, push it in, then press the button until it clips. And then that's how it works. So what's on the bottom of that? Is that just open like that?
It plugs
Oh,
in
plugs
like
in. So I was
that,
like,
yeah,
that would
and
hurt
then
your
it plugs
hand.
into cautery. That's a cautery.
No.
Now like this.
Yep, and then just give it a little shake. There you go, right? And then I'm just gonna do this, and you're not gonna bring your hands right up to my neck because your chance to contaminate. Just let go, and I'll push myself in, and then you're going to glove me. So I usually glove right first, so that's your right. So you want my thumb facing me, right?
I mean, yellow, no, yellow and blue.
Yeah, so you're gonna, yeah, so you're gonna do it like that. Okay? Remember I had a bunch of co-workers come in and we gowned them? It's been a while. Okay, so what you wanna do is you wanna probably have your hands, like let it down, right? And you're gonna have your hands, like if I was gloving you, I would have my hands like this. You see how my hands aren't in the way? So you're gonna have it facing out like that to me, right? Like that. instead of in front, because then I'm trying to put my hand in.
Like this.
Yeah, like that's better, yeah. Okay,
Okay.
all right?